This is Laurel Mildred from the California Collaborative for Long-Term Services and Supports, and joining me today is Gary Passmore, Executive Director of the Congress of California Seniors and a member of the Collaborative. Gary is here to describe several important core services and how they contribute to a high-performing system of long-term services and supports.
Thank you, Laurel. I am really pleased to join you today to talk about a number of the other services that are available in the state of California for seniors and people with disabilities. They are the focus of our efforts to try to create a continuum of care so that people who need a few services have those, people who need a great deal of service and support have access to that. Let me begin by mentioning PACE. PACE is an acronym for Program of All-Inclusive Care for the Elderly. It was created in the state of California. It's a model that serves people over the age of 55 who live in the community but have high acuity needs, that is, that they qualify for nursing home care. PACE is a unique program in that all of the services, both medical and psychosocial quality of life services, are provided under one provider and under a capitated rate. Assisted living, on the other hand, is essentially housing. It is a place that people can live with support. It's available to both older and disabled people who are unable to meet all of their needs at home but don't really require a 24-hour level of care. It provides things like protective supervision and preparing meals, medication assistance, and the like. But people are living on their own in the community, usually in small group settings, although some assisted living facilities are larger. There is a program called Independent Living Centers, which is different from assisted living in that these are actually places that advocate for people with disabilities. They provide information and referral. Independent living centers are part of a national movement to empower people with disabilities. All of the centers have people with disabilities involved in their programming. There's a series of caregiver resource centers in California that provide care to adults of all ages, typically with some kind of degenerative cognitive disorder or perhaps a traumatic brain injury. The services focus on people who care for people in need. They may be family members and provide support to the caregivers, such as respite care, which means allowing the caregiver to have some time away. The caregiver resource centers also help create plans of care, provide counseling, and so on. The last group of services I want to mention are those that are funded under the Older Americans Act. They provide a number of social supports and services to people over the age of 60. Most of us know of Meals on Wheels. There are also congregate meal centers and have not only a nutritious meal but also some companionship. The programs are administered through a network of what are called AAAs, agencies on aging, area agencies on aging. They include ombudsman programs, HICAP, which is an acronym for Health Insurance Counseling and Assistance that helps people understand Medicare. The AAAs provide caregiver support and transportation employment services and the like that help older adults live independently in their home. All of these programs are important. Each provides some unique services. There's a little overlap in services, and California is working very hard to find a way to blend these services to make them more accessible and understandable to the populations being served. We have been concerned that as the older adult population grows and the population of people with disabilities increases, that our resources are very limited. So we're struggling to make sure that adequate levels of service and care remain available.
Thanks for sharing this information, Gary. If you'd like to learn more about other issues that impact long-term services and supports, if you'd like to hear more podcasts of this nature, or if you have any comments or questions, please visit www.ccltss.org or call 916-966-6643.